Good evening, everyone. Today we have Dr. Nazih Alkhatam from the Eastern Province Family Medicine Academy. Today he'll be talking about personal development plan and lifelong learning, which is something that you need to develop during your residency and even earlier on in your education, and continue it further into your life. So Dr. Nazih, the floor is all yours.
Assalamu alaikum. Good evening, everybody. My name is Nazih Alkhatam, family medicine consultant. I'm one of the trainer in the Family Medicine Academy, E1, Eastern Province, Saudi Arabia. It's my pleasure to present to you about the personal development plan and lifelong learning. Initially, I want to thank Vicky and the Saudi Commission for the invitation, and Vicky for the kind introduction. Okay. I'll start with introduction. Okay. I'll start with introduction about definition of lifelong learning. The UNESCO definition is all learning activity undertaken throughout the life with the aim of improving knowledge, skills, and qualification for personal, social, or professional reason. And the International Labour Organization, they defined lifelong learning as all learning activities undertaken throughout the life for the development of competency and qualifications. This is Alvin Toffler. It's the famous writer, American writer. Actually, it's called Teacher of the Presidents. And the effectiveness of his mind or his thinking or his writing, it affects a lot of famous person or political person in the world, including Gorbachev, Mahathir Mohamad. He said that illiterates of the 21st century will not be those who cannot read and write, but those who cannot learn and unlearn and relearn. This is the Henry Ford, the owner of Ford cars. He said that anyone who stops learning is the one who's old, whether at 20 or 80. Anyone who keeps learning stay young, and the greatest thing in the life to keep your mind young. We'll start with the 7 essential elements of the lifelong learning, and the first one is focusing on the growth, focusing on the goal, focusing on your future plan, a future job, or future position. This is inspiring you to reach to this goal and growth. The second one is become serial master. We know that all of the workers, once graduated from the college, just taking their experience during the college, and they graduate after that, and the experience throughout their work, just without any further evaluation. It's like T-shape. And the worker now, or the all organization now, they want for all workers to be like M-shaped. So the experience should be to be through all life of the workers through their working. Now, the third one is the essential elements of learning, of lifelong learning. It's going to the uncomfort zone or learning zones. To stay in the comfort zone, you will not get any further information. So in the lifelong learning, you have to stretch yourself to the learning zone to get a new information, new skills, and attitude. The build personal brand. We know that the brand now, it's one of the things, the most important things nowadays worldwide. Not only for the organization or educational or university, even companies. We know that, these two famous brands, Apple and Nokia. The previous decade, Nokia was leading the market for the phone and electronics. Now, the last decade, the Apple company started to rise and become one of the first 3 companies in the phone media or phone market. Why? All these starting from the brand. the Nokia focusing about not only on the phone, it's focusing about everything. The Apple now, they are focusing about smartphone, and their brand then start to be rise. And we know that we are taking our instruments and our things from the electronics just from the brand or brand logo. Like Toyota and Lexus. We know that Toyota and Lexus is the one company. The Toyota initially start with Toyota logo, and we know that quality of Toyota is the best among the cars in the world. The Lexus, it's something like luxury. So they want to change the brand or change the logo just to know or to inform the customers that Lexus is new things and different from Toyota, although all having the same quality, but the Lexus is having more luxury and more accessories. And we know now in the Ministry of Health, we have a vision of 2030. This logo is inspiring us to reach to our goals in the Ministry of Health and in the kingdom, and give us the support to reach to that goal. So these brands, it's giving us really inspiring to reach to that goals. This is the logo of our Family Medicine Academy. It's including the box and the logo. The Toronto, one of the famous university. We know anyone belong to Toronto University, he become motivated to just to carry this logo to be graduated later on from the Toronto University. This is riwayah from Prophet Muhammad. He said, اعمل لدنياك كأنك تعيش أبدا واعمل لآخرتك كأنك تموت غدا. فهذا يعتبر يعني one of the logo, one of the brand to live for it and to learn for lifelong. يعني it's working for you as you're living forever and working for your akhirah as you are dying tomorrow. And focusing on your own development. The sixth one is do what you love. The Ikigai, it's the Japanese scientist. He started the learning or life learning by answering the 4 questions. The first one, what do you love? What does the world need? And what can you pay for? And what are you good at? If you combine what you love and what your world needs, it's the mission. If you combine what you love and what you are good at, this is the passion. And if you combine what your world needs and what you can be paid for, this is the vocation, it's mihna. And if you combine what you are good at and what you can be paid for, this is the professional or mihani. To combine all of these, it's called Ikigai rules. To combine all of these to do what you love and what the world needs, what you can be paid for, and what you are good at. The last element is to stay vital, not only to learn and taking from your body and healthy. You have to take time for learning, take time for sleeping, take time for rest, take time for exercising, take time to think about your objective, and take time for looking for the healthy food. Now we'll start with the personal developmental plan. Our objective today will talk about the understand and important personal developmental plan, so how to identify learning and developmental needs and how to create objective. By reviewing of the personal developmental plan, it's useful to look your personal developmental plan every 3 months. There's different goals into different interval. Something it's short, something medium, something it's long. Like we call it's like strategic plan. The medium goal should be within 3 months. You have to think your goals for every 3 months, that the goals or objective, you put it in yourself to achieve it, and you have to review it and just analyze it and assess it every 3 months. And during the course, we know that a lot of things affecting your goals, either organizational or external factor, like in our pandemic situation, something happening to us and pushing us to learn about a lot of things, including infection control, ICU courses, and all of these, or all of the things related to the pandemic situation, including vaccine and all the knowledge about the pandemic issue. How to explore your learning needs. Exploring the learning needs, you have to identify clear learning needs. Understand how to write smart learning needs. A lot of tools taken for the objective to be its concise objective. One of these is smart learning, smart methods or smart tools. Also to look your learning style. What's the learning style you are in, either auditory, visual, or other learning styles. The definition of personal developmental plan is a process of establishing aims and objectives that you would like to achieve in the short, medium, and long term. The personal developmental plan then becomes the formal agreement signed off between you and your appraiser and your learner, or your learning and developmental, or even you and your organization. What does the personal developmental plan contain? It should contain 3 to 5 learning objectives, which reflect breadth of clinical practice or non-clinical practice or non-clinical based, responsive to local population, health needs, and your personal developmental needs. Especially, we are talking about a medical developmental plan. Each objective must contain the statement of learning developmental need, explanation how the learning development need will be addressed, the date of this objective, and when to be achieved, and how the objective will be evaluated, and what are the outcomes for this objective. The echoes of four domains, good medical practice, and the British Medical Journal talking about the main 4 domains of good medical practice, including the knowledge, skills, performance, keeping safe, keeping the quality and the safety of the patient, communication, partnership, and teamwork, and maintaining the trust. This is the cycle. We'll go through it one by one in the remaining of the lecture or webinar. The first one, how to identify your learning needs, how to write smart learning objective, and how to know your learning methods, and how you evaluate and review your objective. We will start with identifying learning needs and how to choose the learning needs, how to prioritize your needs, and how to compromise your needs and organization needs. Then the second, we'll talk about the smart learning objective, which is abbreviation of S, specific, M, measurable, A, achievable, and A, R, realistic, and T, time bound. And the learning methods, we know that a lot of learning methods, either visual, auditory, tactile, synesthetic, need experience or need practice, sequential, need step by step, or verbal, interactive, reflective, logical. All of these is learning methods. You have to know your learning methods to reach to your goal, or to reach to your objective. And the 4th one is how to evaluate and review. How to identify your learning needs. Think about the skills and knowledge you need to perform in your role. Remember, your role is called individual, could be team, could be organization aspects. Organization, like in the Ministry of Health, we start to think about a strategic plan for our organization in the cluster under the Ministry of Health. The 6 aspects of the care to the patient, how to develop, how to find my objective. It's meeting the organization learning, how to reach to the goal of the organization with this objective. And individual learning needs, not only for the organization, not only for the curriculum needs. This is something obligatory to learn about it. Think about yourself, your individual needs. Looking for clinical and non-clinical learning. Maybe it's going with the curriculum requirement and something related to your career aspiration and daily based practice, or area of special interest that you want to develop in, or something going from SWOT analysis, strength, weakness, opportunity, threats, looking for your strength, your weakness, and your threats and opportunities, looking for these and try to find objective or try to find gap for yourself and write it down and how to reach this objective with time-bound point. Now, the personal objective and time for it. We have, as I said, we have short term, like for 3, for even for weeks. We have medium term, looking for 1 to 3 years, and we have long term objective or long term goals. Like one in the school, he wants to be a doctor one day, and his is the long term strategic plan for him to reach to that level. How to identify your learning needs. It can be from reflective log from your portfolio, or it can be coming from patient and needs. We are meeting patients daily. We can find our learning gaps and learning needs from patient and need. By reviewing the patient experience, you have to ask yourself on the end of the session or in the consultation of the patient, what the thing that the patient needs, and you have to learn about it. And this is daily practice actually, and you have to take all learning gaps and learning needs from daily practice when you finish for even every patient. Okay, or it can be from significant events. Something happen in your center, something happen in your organization, something happen in your society, and this is significant event trigger you to looking for the learning points and learning gap, and try to find the objective for this event and how to reach to this objective. It could be coming from your colleague, your peer observation during morning report, during discussion, during the observation of your trainer or through your teacher. Or it could be coming from curriculum training or curriculum pack, looking for the skills need to be addressed, need to be reached during each level, level 1, level 2, to the last level, and the knowledge that the resident should take or should take over this knowledge during the training period. Or through the auditory improvement project organization. The step 2 is smart learning objective. How to put your objective in the nice way, and it's in the in the smart tool learning objective is from the specific, measurable, attainable, relevant, and time-based. The objective can be vague. Generally unlike to be not to be achieved, so you have to look for specific objective. So be specific, be the goal or the end of the objective. It needs to be clear, reaching to the goal. Okay, like for example, after finishing of my training period, I want to improve my leadership skills. I want to improve my procedure skills. I want to improve something that's in the acute care or urgent care skills. Okay, I want to learn about this topic and that topic. So be specific about your objective. You have to find the objective that's measurable, something you can measure. Okay, you must be able to quantify the objective in order to progress. The achievement can be measured. If the absolute measure isn't feasible, this you must indicate how progress against the objective are being monitored. something it's achievable. And if you think it's not achievable. And if you think about you are a family physician and you think about the cardiac operations, how to master skills of one of the cardiac operation, for example, you can get it, but it's not achievable. It's difficult to reach that goal. So looking for objective that's achievable. And something relevant to your practice should be linked to your personal development and the needs that you need or the team need or organization needs. And you have to put timeline for your objective. By the end of this year, I want to be this and this. And by the end of this year, I have to pass part 1 exam. By the end of this month, I have to learn about acute cases. By the end, so even during the rotation, by the end of the medicine rotation, I have to take this and this and this skills, and I have to learn about this knowledge and this knowledge. Okay, so just think about your objective now and how it can be in a smart way: specific, measurable, achievable, relevant, and with time bound. And this is one example. By the 30th of September, next September, I have to pass the first part of my family medicine program. So I will go through references, work, and skills, and I will ask my colleagues or my senior how can I pass the part 1 exam. Okay, and something it's specific, it's measurable, achievable, and it's relevant to your practice, even to your training, and with time bound by the end of the exam. How objective will be achievable and evaluated? It's very important, and you have to expect what outcomes you are looking for each objective. Now, the learning methods. We know that there are different learning methods, as I said before, and we will go now through some MCQs. Actually, it's not MCQs, just to have, just choose the best one, or best option for you, and write it down. You know, either A, we have 3 options, either A or B or C. Okay, the first one, just Vicky, we can share the polling. Okay. Okay. And this is just write what you, from this point, when you want to buy laptop, read the instruction about this laptop, watch a video through the social media, or going to the store and trying to find features. Just click which one is the best for you if you want to look for or to buy laptop. And write it down, please, for each now, the question 1A or B or C. Okay. Okay, 5 seconds. Okay. Okay, around more than half choosing P, and almost 1/3 choosing C. So less than 1/3, and just few 3 choosing A. Okay, the next one. When you're choosing a destination for the holiday, you prefer to read review online, ask others for their suggestion, or think about activity you want to do there. Can you choose and write it down also, A or P or C? . Okay, we will shift to the next one. Okay. When I am remembering instruction, I prefer to write the main points down. Relay back the main points either aloud on or in my head, or be able to put a learning into practice as soon as I can. Just choose one of these and write it down, please. Okay, let's move to the, okay, let's just someone and the bowling, okay. Moving to the next one, after I meet with someone for the first time, I'm able to visually recall their facial features, remembering their name and what they do for work, and recalling what we were doing once when we meet, either in the conference or meeting or whatsoever. And write down your choose either A, B, or C. Okay. The next one, when I am working, that's to introduce myself in the person. They can put a face on the name. And if there's someone I want to introduce myself to, one showing the picture and his name in the networking, or introducing myself by phone in the first instance, or be at networking events so we can have opportunity to do something else alongside the meeting. Just choose the best for you. Okay. The next one, and just we have remaining two questions or two statements. When I am worried, I picture the worst possible outcome, running through all the events in my head, or move around and become very restless. Vicky, you just share the poll for this question. Does it appear in the screen? The poll for this one? Yes. Okay. And this is the last one. Sorry. Vicky, can you write the last question? Just among the answer, previous answers, if you choose the mostly A or mostly B or mostly C among all attendees. Okay, just we will share the result, last result. Okay, around 30% were A, and 40% were B, and the 30 were C. And some of the voters, or almost half, between two letters. Doesn't mean that they are purely having a type of methods, maybe having mixed type of learning methods. These just to know you're learning the best learning methods to reach your goal, either auditory or visual or kinesthetic or something to practice on. The one who choose mostly A, they are for learner, and must those choosing B, they are auditory learner. And the C is kinesthetic, something they want to practice for, to learn or to reach to their objective. Doesn't mean that for me, I'm not auditory learner. Learning to something in the lecture during my driving or even in the lecture, I cannot concentrate fully. With the visual issue, I can concentrate, but I'm not purely visual. It doesn't mean even I'm null in the auditory. It's something mixed, but mainly it's visual. So you have to know your learning methods and choose this learning method to reach to your goal. Okay, and if you can combine among these, it will be fine. As I say, the main three is visual, auditory, or kinesthetic, something to want to practice on. Okay, the visual is 65 population. They are visual learning. Okay, they need to able to see what you are learning. The result for this, they want to see a lot of pictures. Okay, a lot of video diagrams. Okay, demonstrations, plays, handouts. Okay, and the auditory, they want to listen. There are 30 among the population. Okay, and auditory learning will have natural preference for learning by absorbing what they hear and to get their knowledge. Okay, kinesthetic, they want to practice even when they are studying hands out. They write the notes. They write just underlying the sentences. So it's something for to choose or to use the hands. It's a kind of experimental learning. They want to practice from what they learn. Okay, this is the 70-20-10 approach. It's famous approach talking about 10% coming from the knowledge, going from the social learning, evolved experiential, looking for the references, and 20% coming from sharing with your team, group learning, working, mentoring, discussion. Okay, and the remaining 70% by doing experimental or experimenting your learning, by applying your learning. Okay, this is the 70-20-10 approach. This is Benjamin Franklin, one of the it's American political. He's famous. He said that tell me I forget, teach me I will remember, and involve me I will learn. So we have to practice something, some skills to get or to reach to our goals and to get this this skillful issue. The fourth step is how to evaluate your objective and how to review it. Okay, there are two issues to reflect on: either whether development activity you have undertaken was appropriate and worthwhile, and your skill or behavior have improved as a result. So you have to ask yourself by the end of your objective, what am I able to do better than as a result that reached to, or has this experience revealed further developmental needs? Sometimes we have we put objective. By the end of this objective, we found another learning needs or another learning gaps. How well did this development method work? Could I have gained more from this activity? Would I follow this approach again? I have to follow it again to get this either knowledge or skill. Is it important then to revise your objective accordingly? So, in summary, just from what we have talking about, the step of the learning cycle, starting from learning needs, setting smart objective, adopting appropriate learning methods, and finally, how to evaluate your objective by passing this exam, by doing these skills, by taking feedback from your trainer, or learning objective that you set need to be specific, measurable, achievable, and realistic and time-bound. This is set for SMART tools. Understand if your learning style enable you to select and vary learning methods. You have to know your learning methods, and you have to concentrate on that to reach your objective. Now, one example, the current pandemic situation, AR cases become more in the PhD setting. So, this learning gaps, any one of us, or he or she may face difficulty for the first step management, how to deal with these acute complications. So from the objective, for example, if the cases were mostly cardiac, looking for how to deal with the acute coronary syndrome in the primary healthcare setting. This is the objective. So what's the methods? By reviewing the latest national guidelines, attending the ER of the regional hospital, and learning how can they deal with the acute coronary syndrome, meeting with the ER team cardiologist about better transportation and communication between primary healthcare and the hospital. And you have to put your time bound and date for this objective. So I have to know the knowledge and the skill how to deal with acute coronary syndrome by reviewing the national guidelines and by attending to the ER, by talking to the ER physician and cardiologist. And by the end of 2 weeks, I have to get this my objective and to take my reflection or the reflection from my trainer or from the peer review, either from the cardiologist or the ER physician. And you have to review, as I said, the outcome for you with your peer or trainer or consultants. Okay. I think this is the last slide for me. Already I summarized what I have talking about. There is some question. Vicky, can I go through this question, or if you want to open the mic for anyone who want to share?
Sure. We're going to allow participants right now to unmute themselves and ask their questions directly, or they can just drop it into the chat box.
Okay. The first question was about the objective. For example, one of the attendees asking about how to pass the first part exam. Yes, you have to be specific and the objective and the methods, learning methods. You have to know your learning methods. And you have to know even the reference. By the end of this year, I want to pass the part 1 exam by reviewing or going through the references, important references for family medicine. And by also discussing with my senior and discussing with my peers, okay? And looking for the domains and the curriculum that should be covered in the first part exam. And you have to go deep to look for the type of learning methods you have to go through it to reach to your target or to reach to your objective. If you have any question, just write it down in the chat, or you can unmute yourself and ask.
Okay, if we don't have any further questions, then we might as well just wrap up tonight and finish off, Dr. Nazih.
Just I would like to thank Dr. Nazih for this very interesting webinar, which is covering a real important thing that each one of us need to know and to practice by having personal development goals, objectives, and professional development programs are essential, especially in our practice as a physician in the field. Thank you, Doctor, for covering this and giving this interesting, comprehensive overview about this important topic.
I would like to thank Dr. Nazih and Dr. Aisha. Victoria, this first webinar I attend. I'm Dr. Badr, consultant family medicine, enjoyed program Medina. I'm seeing this topic, personal development plan, and I would to add one point regarding trainees. If you will not practice and if you cannot find your needs, learning needs, you cannot put your objective. That's why it should be stay with your trainer, with your supervisor, and ask yourself for each rotation, for each any activities doing during your program or residency, to put your objective, to sit with your mentor, and to set your goals and write it, as Dr. Nazih said, it's in smart form. This is a plan. Plan meaning should be tracked, and should be there is development your milestone, your skills, and your also background and knowledge. Please sit with your supervisor, ask him, contact with him, sit with him, will be inshallah get a benefit. Thank you for all. Get a benefit from this webinar.
Dr. Nazih, we have one resident that actually asked a question saying, I have frustration that when, for example, I start reading the material related to family medicine and other medical specialties, by the end of the year or after a few months, I tend to forget almost 60 to 70% of the material. So what's the point if I will forget that?
Okay.
So how can she remedy this?
Yes, yes. I think one of the slides, it was this one, about Benjamin Franklin. He said that involve me, I will learn. All of these, we know that the family medicine is generalized specialty. It's covering all aspects, all ages. So when you set your objective, by the end of your time, you have to review your objective and you have to practice it. Yeah, not only to take this knowledge. If you don't, as Dr. Badr mentioned before, if you don't discuss it with your trainer and if you don't practice it, you will forget it for sure. A lot of things during our rotation or during the family medicine rotation, it happened in the hospital. It's not daily based in the primary health care. So to get it, you have to review it regularly and you have to discuss it with your the peers and your consultants, and you have to practice it.
And then, I'm sorry.
Can I add to
the
answer
ahead,
of Dr.? Okay, so about the same question of forgetting. So this is something normal, and Dr. Nazih had the right slide that tell me I forget or I read I forget. So that's quite normal, and unless you practice, obviously things would fade away with time. So one thing that you can adopt is discussing with your colleagues and teaching your colleagues. Okay, so for example, if you read something, okay, find someone of your age, senior or junior, and teach them. This is really an effective strategy to remember the things, because this comes under the practice that, okay, once you're discussing in terms of teaching someone, so obviously you need understanding of that topic, and that also deepens your knowledge for that particular topic. So find someone to teach, either your colleague or your junior. So this might help you. Thank you.
Thank you very much, Dr. I think also the 70-20-10 approach, it's helping this issue also, because only the knowledge coming from 10%, you have to discuss it with your peers, with your consultants, as a 20% with discussion, and you have to practice it in 70%. So to not forget it later.
We have another question that says, some people suggest that we read and focus only on what we face in real clinical life. Is that correct in your opinion?
No. That's in the first slides we take about yourself. You have to think about yourself, what you need, not only from your clinical practice. Sometimes not related to the clinical base, something related to your personal. You have to get it as a personal skills. You have to get, for example, even computing. It's one of the skills you want to get it as an objective. So not necessarily coming from the clinical life, something that's related even from the social life. You want to get it from even non-clinical based.
Excuse me, would you allow me to just comment on this point? I think the resident asked here, some people suggest that we read and focus only on what we face in real clinical life. Is that correct or no? I think for clinical knowledge and clinical improvement, yes, reading upon the clinical thing is very important, because as we know, common things happen commonly. So you have to master what you see in the clinic, but it is, if you want to pass the exam, it is not enough. Absolutely, it's not enough, because, for example, you will not see the clinic biostatistic. You will not see in the clinic, for example, some basic knowledge you will be asked about, okay? Some red flags for something. So you have to master what you see in the clinic, but you have to be aware what is the requirement of the exam. If the question about the exam, no, clinical scenarios is not enough, but it's very essential in your practice.
Yes, thank you, Dr. Okay, any other question?
any of the trainers that are present here would like to weigh in, also you're welcome at any time.
There is one more question, Dr. Nazih, if you could answer. Okay, can you please mute your mic? Okay, so there is another question, Dr. Nazih. What about Plan B, which is be used most of the time by our residents? Is it helpful for them? Any comment on Plan B, Dr. Nazih?
I didn't get the question. What
I know Plan B only for contraception. Is there any other Plan B we don't know?
Can you explain, Dr. Hadi, about Plan B? I didn't get the question.
السلام عليكم. طبعا plan B I think in يعني what is an alternative plan, because أنت لما تحط لك main objectives depends on what you need to learn and depends on الهدف that you want to achieve. You have to put an alternative plan sometimes, which is كثير يقعون فيها إنه they put a big goal for short time and they don't achieve it, then they get frustrated, then they يدورون لهم مثلا plan B, which is will not work لأنه يكون level of stress really high. So أشوف إنه يعني I would advise you صراحة الجميع sit with your mentor, discuss with them your study plan, our learning plan, review your curriculum. The curriculum has a lot of يعني very good information, and there is at the end there is appendix about each level what you need to master. Put your plan based on that, based on the level of knowledge that you have, and give yourself time enough for achieving the goal. Through that plan, as if you want to do it weekly or monthly, also put a time, specify a time for yourself, for مثلا watching movie. لأن أنت if you study all the time, there is something we call it cognitive load. Your brain with information will be saturated, so whatever you do, whatever you read, it will not grasp anything. So give that time for the information to settle down in your brain. Try all the time, try to apply what you learn, reflect on if you have a new information or a new experience, reflect on it, summarize what you learned from it. So by this point, by this way, understand also the way your brain work. For example, I'm an auditory person, so whatever I hear, I memorize. Someone else, he has to see a picture and or a diagram or flow chart. So understand your brain, how this information enter your brain, and find a way, the similar way to retrieve it. So all these the dynamic, what happened in your brain, you need to understand what's going on, then to plan your study, the study plan. I would advise صراحة to sit with your mentor or with one expert in medical education on how that brain is work. So it will help you to understand yourself. Also use some tests. There is a lot of tests online, will help you to identify yourself, which type of learner you are. That will help you a lot to save your time. We provide a course to our residents. We call it study, smart study. So this is يعني my advice to you. It is really difficult at the beginning if you want to put a plan. لكن go to your mentor, sit with them. There is a form موجودة أصلا في النت, personal development plan موجود على شكل جدول, and you can تحط الأفكار whatever you want of ideas to achieve your goal. And thank you so much.
Thank you, Dr. Nada.
Good evening, everyone.
Yes.
Good evening, everyone. I'm Dr. Houria Al-Faraj. I'm R4 resident. You were talking about the dilemma of studying to exam and clinical improvement in your practice. And that's motivate me to open my mic and talk about my own experience during these 4 years in the program. So when I was R1, I was very motivated to develop myself clinically and also my knowledge. And then I was so good, and all my trainers were happy with my performance. I did good in the OSCE, I did good in the mid-year. And then when I entered the Part 1 exam, and I'm not ashamed to say it, I did not pass. And it was really shocking for me. So that changed my development plan hugely. I was shocked why I did not pass the Part 1. I was R1, so I entered the promotion exam. I'm happy I passed. And it affected my development plan. I was studying all year for MCQ. I was studying all years for passing exam, and it affected my development plan negatively. I think because we have a lot of exam, a lot of requirement, promotion, and things like that, that will affect our confidence if we didn't do that, if we didn't pass it. And now I'm now R4. I have a lot of responsibilities. I can't believe that by the end of this year, I will be a specialist on my own, and I still want to learn more. I want to develop myself more. So I sometimes look at the exam, if it is overdoing it, if we are overdoing the exam part, it's gonna affect our learning and development negatively. And I am right now in R4, very overwhelmed, very stressed out, very, I don't know what to say, actually. I'm trying to develop myself and all over again. And I just wanted to tell you about my experience, and that studying for the exam and developing yourself as a physician is two different things. And we have to learn how to balance between the two. Thank you so much.
Thank you, Dr. Houria. Thank you for your answer.
Yes. Thank you, Dr. Houria, for sharing your experience. But what I would like to comment on this, as a trainer and observing resident passing through the exam, and even me myself, I was resident. I want to assure you something very important. If you did good in the every day-to-day clinical work, okay, trust me, you will pass the exam without even studying. What I always encourage the resident to do, you have to have even R4, R1, R2, R3, whatever level you are, you have to keep a log book for everyday clinic. At the end of the clinic, you have to read at least about 2 clinical scenarios. For example, let's say we are seeing every day like 20 patients with diabetes, but each case we have something interesting to read about. One, for example, like high microalbumin creatine ratio, and what should I give her for this? Another one, okay, she's having another comorbidity, how can I do with these things? So every case has different area to develop yourself regarding it. So don't leave the clinic without having a logbook, at least to read about 2 of them while you are still in the clinic, okay? And at the end of the week, you have to read at least about 2 cases from your clinic again, okay, in detail about it. If you do this every day and every end of the week, trust me, you will never need to study more for the exam. And the other thing, which is very important, that clinical, now the OSCE is typical clinical thing. It's based on what you are doing in the clinic every day. And the marks that we are giving in OSCE is typical what you are doing every day. Introduce yourself, you get mark. Say eyes, you get mark. So don't worry about the exam. Worry about being a good physician. And once you worry about being a good physician, you will pass the exam without any problem.
Dr. Ala. Just I want to add to Dr. Ala, and this is the message that I gave to my trainee in the center, junior or senior, especially the senior. Act for 2 lines, for the exam and for your real clinical practice. As you are senior, you feel you have to behaving as specialist. You have to face all difficulties and you find out all solution, all learning needs. If you are I want to be not alone, but especially you are the senior one in the center in the future. So you have to be good in your clinical practice. So acting in this line, as Dr. Ala mentioned, it will cover for sure, it will cover the exam line, but something need to be added in the exam line. We know that the references, it's need to be revised for the exam, MCQs, some references books, but real clinical practice is the most important thing to get all learning gaps and to fill the gaps you want to fill it for your clinical practice. And thank you, Dr. Horia, for your honesty. And I think this this perception is for almost a lot of residents, and especially in the senior levels, R3, R4, about to they want to ready for the exam and they want to be good physician later on. So acting on both 2 lines. And from the clinical practice, the gaps that you can fill it for your clinical practice in the future, and even for the exam in the OSCE or the MCQ. Okay. Any other question or any other trainer want just to share about this point?
Yes, doctor. I want to give a comment about the R4 resident who mentioned studying for the part. From my point of view, that studying MCQs, this is effective to pass the exam, but for me, I'm not satisfied with this method. I don't see any benefit for me as a clinical doctor or improving my practice, but it reached me to the point to passing the exam, but I'm not satisfied with this. What is how to deal with this? Yeah.
Would you allow me to comment on this? I have one of my residents passed a first part exam this year actually, and after passing the exam, I met with her. She said to me, "Thank you very much. While I were attending with you in the clinic, you used to teach me the way of thinking, the critical thinking, and how to eliminate the wrong thing, to put it, for example, in differential diagnosis in the answer." So even she said that just remembering, even a thing that I'm not sure about it, just remembering our discussion in the clinic, it helped me to answer the MCQs in the first part she was talking about, to answer the MCQs by just thinking critically about the answer. Okay, so even the MCQs, you have to be active and proactive in the clinic and with the discussion, all discussion. Usually we listen to, for example, when we attend a lecture, we listen passively. We shouldn't do this. When you are attending the WADA, most probably all the MCQs will come from the exam. It will come from the thing that you are attending already. Okay, so be critical. Try to notice the cues that when, for example, if I'm presenting a WADA for you, they will ask me about, for example, MCQs to put it for you later on. Okay, so be attentive to the cues. Be attentive to the small thing that it discussed again and again, and try to be critically thinking even about the MCQs. Usually you will answer it well.
Thank you, Dr. Ala. Dr. Muhammad, as you mentioned, and as I mentioned that it's two-line. I know that MCQ is important, but it's not like a clinical experience. You have to get all the learning gaps from clinical experience, and you have to proactive, as Dr. Ala mentioned. From these clinical experience and learning gaps, you will get your information and your knowledge for the MCQ. But it's not enough to passing the exam purely, but because just looking for the MCQ, not for the knowledge, for the just tricks how to the MCQ running, for the types of the MCQ, what is the keywords and the MCQ, how just to learn a type of MCQ. But the main knowledge coming from your clinical practice and your daily work.
Clear, Doctor. Thank you.
Thank you. Okay, Vicky, do you have any other question, or?
I think we're good to wrap right now. If there's no further questions, nobody wants to share any of their personal experience. Thank you all for coming, and see you on the 9th of March for another webinar.
Thank you all for attending. And thank you, Vicky, and thank you, Saudi Commission, for kind invitation.